My name is Mary, and I'm an occupational therapy assistant student at Bryant and Stratton College in Wauwatosa, Wisconsin. Welcome to our interactive video on removing basic home hazards and reducing fall risks for older adults. The population this video is intended to be used for are older adults with conditions such as arthritis, dementia, history of falls, or other conditions, but still live alone and need some education on removing basic home hazards to make an overall safer environment and reduce their fall risks. Throughout this video, I will discuss how to identify common household hazards and solutions on how to make the rooms safer. I will also introduce a checklist that can be used in each room of the house to make sure that the environment is safe. Some potential safety concerns to consider. Individuals may need assistance with removing the hazards depending on their level of mobility, strength, independence, and the type of hazard. Take caution when moving heavy objects or objects on the floor, as this may cause injury or fall. Overall, be careful, and if you need assistance, contact a friend, family member, or qualified professional to assist. The supplies needed for this video are assistance to move objects, a place to store or dispose of hazards once removed, a reacher, such as this one, to move objects from the floor or high up in cabinets, and other materials such as night lights or high wattage light bulbs to make areas of the home more visible and safe.
Pause the video now and gather the supplies listed on this slide. Please have someone present with you during this tutorial to discuss what hazards you see in each room. If you are unable to complete this video with someone else, get something to write with and a paper to write down what hazards you see. The optional supplies listed, such as high wattage light bulbs and wall hooks, are not required, but they may help make the environment safer. Throughout this video, you will see me using a reacher on and off to pick up objects. Ultimately, it's up to the individual who is removing the hazards to use it as they feel comfortable. Again, this is not a required supply.
To practice identifying common household hazards, I will begin by demonstrating a picture of a room with household hazards in it. Take a mental note of what hazards you see in the picture. Then, I will demonstrate how to remove those hazards and make the room a more safe environment.
Before we get started, I want to discuss rugs for a moment. It is sometimes difficult to determine if rugs are a hazard or not because they can be helpful in preventing slipping, but they can also be a danger. In the next slide, I will demonstrate the rug test to determine if a rug is safe or not. In addition to this criteria, it is important to think if the rug is necessary or not. I will be removing rugs that are on top of carpet as they are not serving a purpose to reduce the slip hazard. In this case, they make the floor uneven and corners can be turned up or the rug may be wrinkled somewhere, which creates a huge fall risk.
I will now demonstrate what is called the rug test to help determine if the rugs in your home are safe. To do this, you will try and move the rug with your foot. If it moves at all, this is not a safe rug and should be removed or replaced with a non-skid rug. Take this for example. Notice how it's moving? That is not a safe rug. This one is stable and non-skid. It is not moving while I kick it. This rug will need to be replaced.
We will first identify and remove hazards common to a bedroom. Pause the video here and note which hazards you see on the floor in this room. Here is another view of the room. There are some additional hazards in this picture. Pause the video here and note what you see.
Here is how to remove some common hazards from a bedroom. Over here, an open drawer is easy to walk into and injure yourself or cause yourself to lose balance and fall. Make sure you close drawers after yourself in all rooms of the house. Also, there's garbage on the floor. If you have garbage from papers or tissues or anything, make sure you put it into the garbage right away, or at least keep it up out of the way and put it in the garbage when you're able to do so later. Over on the side of the bed here, there's a long cord hanging in the way. This causes a trip hazard getting in and out of bed. There are a few options of ways to keep this out of the way. You can tuck the cord back behind the bed. You could put it in the drawer here so it sits up higher and tuck it onto the nightstand like so. Or, because this bed has posts on the corners, you can wrap it loosely around the corner so it holds it up out of the way on the side of the bed, but it's still accessible when needed. Over here, this blanket is a trip hazard. When not using it, it should be folded up and either kept on the bed, in this blanket chest, or on a chair if possible. The blanket basket also needs to be pushed back into a corner. Any furniture in the middle of the room is a trip hazard. Over here, there are some papers on the floor. If you have important papers, make sure that you keep them together and filed away or somewhere safe so you know where to find them. These papers are important, so I will collect them up and put them on my end table. If they're garbage, make sure they get disposed of. Over here, the laundry basket has spilled over and it's creating a big hazard in the middle of the room. Laundry should be gathered in a basket and never left on the floor. If possible, tuck your laundry basket away in a corner so it's not in the way. Over here, there are shoes that are spilling out of the closet. This is also a trip hazard because I cannot get close enough to reach the items in the closet. Make sure that your shoes are properly stored somewhere. And that's how you clean up the bedroom.
Here is an after picture of the room with the hazards removed. As you can see, the floor space is wide open and there are direct routes to the bed, closet, and dresser, which is important for safety. The next room in the home in which we will identify hazards is a bathroom. Pause the video now and write down or discuss what hazards you see.
I will now demonstrate how to clean up the hazards from a small bathroom. As you can see here on the floor, there are some towels. If they're still clean, hang them up out of the way so they're not taking up space on the floor and causing a fall risk. If they're dirty, just like these clothes, put them in the hamper when you're done with them. I'll leave those here for now. Back here, there is a towel basket that's sticking out in the way. This is blocking my way to get to the toilet safely. Push that back in a corner, or put towels in a cabinet or something else out of the way. Same thing with the garbage can. That was also in the way. Here, this scale is in the way. Because this is such a small bathroom and there's not much place to store things, it would be safest and most appropriate to keep the scale in a different room of your house with more walking space.
Here is an after picture of the bathroom with the hazards removed. Did you catch them all in the first picture? The next room in the home with hazards, which we will discuss, is a hallway. The hallway used in this demonstration is one between bedrooms in an upstairs of a home. However, the same principles can be used when discussing an entryway hallway or other hallways within the home. Pause the video now and write down or discuss what hazards you see.
This hallway has a few hazards in it. As you can see, there are carpet runners on the ground. Those are unnecessary because the floor is already carpeted. They become a trip hazard and dangerous, especially at night. Remove those and again, dispose of them if you don't need them, or place them in a closet or a drawer. Now, the vacuum has two trip hazards. The cord is on the ground and it's in the way over here. So, when you're done using the vacuum or other electronic appliances, ravel up the cords nicely and then place it somewhere out of the way but still accessible for when you need it, such as a closet or a spare bedroom. And over here, there are books on the ground. Coming out of this bedroom, this is a trip hazard right here. Those can be put on a bookshelf and stored neatly out of the way. Lastly, a nightlight will be important in this hallway, especially for helping see at night, but during the day because there are no windows in this hallway.
Here's the final view of the hallway with the hazards removed. As you can see, the floor is clear and the nightlight is there to bring more light into the hallway and make it safer, especially for moving at night. The next room in which we will discuss hazards is the living room. Pause the video here and identify what hazards you see in this visual. Here is another view of the living room with more hazards visible. Again, pause the video and identify what you see.
Here we are in the living room. As you can see, there are a lot of hazards possible in this room. Items such as throw pillows should be left on the couches or chairs that they belong to. Shoes, if you kick them off while you're sitting down or relaxing, should be placed on a shoe rack or out of the way. Newspapers left on the ground are a slip hazard as well. These should again either be disposed of or left on an end table for reading later. Pet toys or grandkids' toys are always around, but it's important to keep them out of the way because those can be a great trip hazard. Over here, out of the way is a good place, or in a toy bin. Same with this. Blankets, similar to throw rugs, should be folded up and either put in a designated place or left on the chair so they aren't laying on the floor. Rugs, again, should be removed if at all possible, but if they cannot be, leave it there, but make sure all edges are smoothed out and it's flat on the floor and not slippery. A lap desk left in the middle of the room should be placed out of the way. Leg rests for chairs out of the middle of the room. Over here, we have a large item in the way, which is this floor lamp. If we bring it from this side of the chair to the other side, it will still bring enough light to the room, but it will be out of the way and still reach the plug. The extension cord for the chair is wrapped around. So this can be looped over the chair and then either taped along the base of the wall or wrapped up and kept out of the way this way. There are also some other adaptive ways of keeping the cord out of the way, which I will demonstrate next.
Here are some examples of wall hooks that are a great option to wrap up cords and keep them out of the way. These are available at local retailers such as Walmart or Home Depot, or are also available online at Amazon. Here is the final view of the living room with the hazards cleaned up and removed. The next room in the house in which we will discuss hazards is the kitchen. Take a look at the pictures in this slide and the next slide. Pause the video if needed to identify the hazards.
In the kitchen, there are more hazards than just fall risks. Let's take a look. Something spilled, such as a water cup, can leak onto the floor and create a slippery surface, which is unsafe. Make sure that you're careful, and when things are spilled, to clean it up right away, or have somebody assist you doing so. In this area, there are a few hazards, such as this knife sitting out on the counter. That's very dangerous because if you're reaching for something, you could cut yourself. Make sure to store it in an appropriate place where it's out of reach. This drawer open, I could walk into and hurt myself. Make sure all drawers and cabinets are closed. And pan handles, if you leave pans on the stove when you're not cooking, make sure that they're out of the way and the handles are turned away from the outside. Rags should be hung up somewhere and out of the way because those can be slippery on the ground as well. As we just determined by our rug test, these rugs are not safe, so they need to be removed from this kitchen area. An important tip for energy conservation in the kitchen is to have a seat accessible while you're cooking or doing other things in the kitchen. However, it becomes a safety risk when it's left in the middle of the walkway. When not using it, make sure that it's tucked away in an appropriate place. Over here you can see I've missed throwing a few things in the garbage can. If this happens, it would be a good idea to keep your reacher close to your garbage, such as tucked over here, so that you can safely pick up and throw away garbage without risking a fall or injury. Another hazard in the kitchen is overreaching or bending or carrying heavy objects. If you frequently use objects such as a mixer, store those on your counter instead of in the cabinets to prevent those extraneous movements.
These are the final pictures of the kitchen with hazards removed. See how there is an open walkway and no trip hazards on the floor. In this visual, you can see that the spill has been cleaned up, the knife has been put away, and the other hazards removed. Here is an assessment that you can ask yourself for each of the rooms in your house to determine if there is need for solutions to hazards in there. Is the lighting too dim? Yes or no. Is the lighting too bright? Yes or no. Are there grab bars in the appropriate places, such as the shower or tub and by the toilet? Yes or no. Are there objects on the floor that should not be, such as papers, shoes, clothes, toys, or figurines? Yes or no. Is the furniture unstable or in need of repair? Yes or no. Can any rugs, lamps, end tables, or other objects be removed to make a clear path? Yes or no. Are there any electrical cords in the walkways? yes or no. If you answered yes to any of these questions, that represents a hazard which should be taken care of. There is also a space at the bottom to write your solutions that you plan to make to alleviate these hazards. If you want to do so, complete this for each room in your house to make a plan to make your home environment safer. Thank you for watching this video on removing basic home hazards. Therapists, we would greatly appreciate your feedback on the implementation and ease of use for this video. Please use the link in the description and complete a short survey so we know how we're doing. Thank you.